My name is Joe Padilla, and I am with the Grace Alliance. And again, the Grace Alliance is an organization where we integrate neuroscience and our faith in Christ so that we can see mental health transformation in people's lives, their marriages, their families, their own lives. And we also see that happening and working through the church. And so we do that through our resources, our education and training, and our small groups. And we've got a vast network of small groups that are meeting across the U.S. and around the world. So now we're having this discussion in this webinar so that we can talk about the impact of the coronavirus and the pandemic and the stress that's causing us, and to really talk about that from a grief perspective. And then I see we've got a lot of people that have registered and a lot of people that are attending. And so that we've got people from all over the U.S. and we got people from 5 different countries that are tuning in. So welcome, guys, for tuning in for this special time. Okay, so what I want to do now is I want to introduce our guest. This is Dr. William Bill Hoy, and he is a clinical professor of Medical Humanities at Baylor University and a leading expert on grief. Now, and he has authored 6 books on this topic. And also, since 2012, he's been an active board member of the Association for Death Education and Counseling. Even has held offices within that board for about 6 of those years. And he also is an advisory board position for Our House Grief Support in Los Angeles, California, Pathways Volunteer Hospice in Long Beach, California, and the Tragedy Assistance Program for Survivors in Washington, D.C. And he is a frequent presenter. He is a national speaker among other professional colleagues in the healthcare all over the United States and in Canada. So we are blessed to have him as our guest for this special webinar. So please say hello to welcome to Dr. Hoy, Bill Hoy. Hi there. Let's see if.
Thanks, Joe. It's delightful to be with you guys. It's an honor to be with you today.
Okay. All right. So let's. So what we're going to do with our discussion, we're going to kind of do this in 2 parts. We're going to do this in perspective. So we're going to just pick his brain here on just perspective about grief and how this is impacting our lives. And then we're going to transition the conversation towards our practical. What are practical ways that we can deal with this, and even get into some scripture and things like that. So let's go ahead and dive in with some perspective here. So now, Dr. Hoy, when this all kind of started, I remember this is kind of like mid-March, and this is kind of obviously weeks ago, when the governor of Texas canceled school and things like this. And I remember my daughter, she's a senior in high school, and she was just sharing how she and her friends were all frustrated that school was being delayed. And as a senior in high school, she was missing out on prom and even graduation and all these types of things. And I remember she was saying, you know, all these years that we've worked up to for graduation and all this stuff through school is now all a loss, you know. And there have been some days of tears of disappointment and things like that. And we've had honest conversations about this. However, but the point of this is that everybody's experiencing some sort of loss, whether it's a job or the finances or routine or something like this. And just much like these seniors in high school or even college for that matter, we're all experiencing some sort of loss in some way. So if you can just help us realize that some of this is grief, and this is a natural response to disruption of life or even trauma. So help us understand this stress grief impact from this virus, this pandemic, and just give us some perspective and why it hurts so much.
Yeah, thanks, Joe. Well, you're exactly right, and you've pegged it when you said that grief is a normal response to a disruption. The old English way of referring to bereavement or to be bereaved, the word literally means to have been robbed. And I think that's a pretty good way to say it, is that most people today feel that they have been robbed of something. I work a lot with seniors at Baylor. A lot of my students are pre-med students. Actually, most of my students are pre-med students. And so they're struggling with some of the same things your daughter is, you know, the loss of the last part of this final semester, the experiences that they thought they had coming. I had a student just last week who said, you know, how was I to know that the last time I would say goodbye to my friends would be the last time I would say goodbye to my friends? And So loss, grief is really a good way to describe it. Grief, though contrary to what is commonly popularized, and my goodness, I've seen it already just in the last couple of weeks, grief does not work along any predictable set of stages or phases. In fact, most of us that do bereavement work full time or professionally now have long since jettisoned even that kind of language that implies this sort of linear process to grief, that I do one thing and then I do another thing and then I do another thing. Rather, grief is at its heart a bridge between the world that used to be and the world that is going to be. And I'm crossing over that bridge when I am in grief. And the whole process of grief is fundamentally about rediscovering who am I now in the light of this loss or these losses. So if I've lost my job, I have to figure out who am I now, now that I have lost my job. If I can't complete high school graduation kinds of things with my friends, I have to figure out, so who am I now? And loss changes us. It doesn't ruin us, but it does change us, and it turns us into new kinds of people. So I think that's probably the heart of what we are experiencing as people, as we realize, and of course every day is a whole new set of losses in this current crisis.
No, that's really good. No, I like how you said that. It's it's kind of a bridge from where we are to where we're going, and we'll kind of get into a little bit of that too. Is so from a stress impact on the brain and the body, just from the science of all this, and I'm sure you can go very deep in this. But what insights can you bring to us about the science or the physical effect or the brain effect of how grief is working, so that we're more aware of how this is impacting us?
Sure. So grief, and typically, just so I can define terms, typically we think of grief as our experience of any kind of loss. Most people in the field refer to bereavement as specifically death loss, so when we talk about a person being bereaved, we're talking about him or her having experienced the death of a loved person. And then, of course, mourning is kind of grief gone public. It's the rituals and the sort of our expression of it. So when I use terms, I'm trying to sort of keep those in mind. What I would say about this experience of grief for us in this particular context is that it does have a dramatic impact on how our brains function, how our bodies function in general. And we know that stress of all kinds for the last 40 years we've known has a deleterious effect, a negative effect on our physical well-being. One of the downsides, I believe, to our current dialogues about coronavirus, which of course is the viral infection that leads to the illness, which is COVID-19. One of the downsides is that we have largely privileged the physical or the physiological in that conversation. Most of our public health missives are about not being exposed to the virus, not being exposed to people who might be carrying the virus. It's all about physical well-being, and I'm not depreciating that. We need to stay physically well, but what I think we are not taking into account of is how levels of stress, grief, and loss have a dramatically negative impact on our physical well-being too. So coronavirus might not kill you, but isolation will. And it's one of the great concerns that I have when we start saying to elderly individuals, our elders who are frequently living already away from their community. They're living, for example, in a skilled nursing facility or somewhere like that. And now we're saying you can't have visits from any of your family, and the staff that are there will be physicians and nurses, and we're going to turn all other staff away. In fact, it drives me crazy, but we have skilled nursing facilities right here in Waco who have determined if you're not a physician or a nurse, you are what they term a non-essential employee. which means anyone from the behavioral, psychosocial, spiritual side of the aisle, chaplains, social workers, clinical psychologists, anybody other than a physician or a nurse is excluded from care of the patient. And as much as physicians and nurses might like to provide psychosocial care, that's not what they were trained to do. And most of them don't do it all that well by their own admission. So I'm greatly concerned that we turn families away and we turn the professionals who could most help away. And I think that is extraordinarily short-sighted on the part of administrations who are making those choices. It's a very wrong-headed policy in my judgment.
Wow. No, that's very fascinating, and it's very true. And I'm sure we'll get into some of the practical stuff of this as well. Would you say that a lot of this is just going to increase more anxiety? You said something about earlier about the long-term effect of that. We were talking earlier, you were sharing some stuff. Can you bring us into some of that?
Yeah, absolutely. So I think, right now everybody seems to be focused on getting to May 15th. That's sort of the magical moment that which as you have alluded to, keeps moving. And I think it will continue to move wherever the curve flattens or the crest occurs or whatever model or terminology we're using. And again, I don't depreciate those things at all. I'm not at all saying, well, sort of torpedoes be damned, full speed ahead. I'm not at all suggesting that. What I am suggesting is we absolutely must be having conversations about the long-term effects psychosocially on people and spiritually on people who have been isolated or left to die alone. And I'll be honest with you, I talked last week with a half a dozen funeral directors around the country. I spend a lot of time with them because I've done death for a living for 35 years. So I have a lot of funeral director colleagues and friends around the country. And I talked to half a dozen last week, and every single one of them has had in her or his care in the last 10 days a family who was taking care of a loved one in a nursing home who could not visit that person for the last 2 weeks of his or her life, who died of something completely unrelated to COVID-19. And these families are expressing to funeral service professionals things like, the thing I most promised my dad that I would do when he was dying is I would take care of my mom. And now my mom has died with us not being able to be there for 2 weeks. And the kind of regret and the mental health sequelae, the complicated grief that is going to set up is something I think we're going to be sweeping up the pieces for another generation or more. This is not something that is going to go away May 15th. I suspect we're going to barely begin to even know what the depth of the damage is by May the 15th. We'll only know who died then. We won't know a lot about what the long-term effects of this is on us.
Yeah, no, that's interesting. Now, I'm just gonna get curious here. So, can you specifically, like, what things do you think we're going to see? Just from your studies, what when we talk about we just don't know. What we might be able to see.
What could we see? Yeah, sure. What might we see? What will we probably see to some level or another? So I keep reading in the media things like how unprecedented this experience is. And obviously there are parts of that are true. There are absolutely parts of this that are unprecedented. Major epidemics and large numbers of people dying in a short order is not particularly unprecedented. I teach the history of medicine. We have pretty good records. This is not our first rodeo. It is with this virus, and it is for most contemporary Americans, but it is not in the spectrum of history. So, for example, we had 418,000 approximately U.S. service members who died during World War II in a period of less than 100 months, 88 months, I believe it was. Around 6,600 per month on average way over 1,000 a day in several cases. What we know from the soldiers, sailors, airmen, and sailors who survived that is that it created long-term mental health sequelae for many of them as they relive the trauma of a friend dying or of being in a near-death experience themselves. What we know, of course, from Hurricane Katrina and the experience, especially in New Orleans, the emotional toll that that took on people there is still reverberating 15 years later. And my colleagues who are practicing among those populations, I'm not, but my colleagues who are practicing among those colleagues are significantly concerned about the ongoingness of those. What we know about complicated grief is that anytime a person feels like I didn't do all that I should have done or could have done, it sets us up for guilt and regrets. And, well-meaning people often say, well, you couldn't go see your mom in the nursing home. It's not your fault. Unfortunately, that rational explanation does not do much to salve the emotional hurt in our hearts.
Wow. So okay, so you're basically saying and that we're going to see a ongoingness of some sort of mental health factors that on the backside of this, and we really need to be thinking through the now and the then, and not even just like you said, not even after just May 15th. It's a year from now, 2 years from now. What is the ramifications of this so that we can get through this?
Sure. Well, and truthfully, Joe, I think preventing death is only one part of what has to be our goal right now. That, stopping transmission is vital and it's important, but that's only one. That's the tip of the iceberg. If we have 240,000 deaths in the United States, and I realize you have listeners and viewers from Canada, I'm more familiar with our data. If we have 240,000 deaths in the United States, which is what the current sort of with current guidelines, that's our sort of our worst case scenario, though it could get a lot worse if we quit physical distancing and some things like that. But assuming we have 240,000 deaths and assuming that not one of those people would have died this year anyway, which is a faulty assumption because so many of the folks who are dying from COVID-19 are people who had multiple other underlying illnesses and were aged and would have likely died in months anyway. But assuming we have 240,000 new deaths, because we have 2.8 million deaths in the United States every year, what we're talking about is an 8% increase in deaths, an 8% increase in mortality, and that mostly among the older set where we typically have fairly high mortality to start with. That's not what one would think reading the daily newspaper or watching the internet. One would think that we are on the verge of half of the world's population being destroyed by this virus. That's what one would think. That's just not, we have to contextualize the data because that's not at all what the data shows. But even so, in my judgment, 240,000 deaths, as horrible as that is not even the worst part of this. It is the tidal wave of other issues that trying to prevent those deaths or holding it to 240,000 might entail. And I think what that means for you and me and for our viewers is that we have to redouble our efforts to be present and to be mindful and to be watching out and to also keep our own sanity in check in the process. And I'll be happy to talk about any of those.
Okay, no, this is fascinating. This is what we need. We need to hear from professionals like yourself to give us a broader perspective of how to look at this and really prepare for what we need to do now and obviously for the future. So, okay, now I want to get into some practicals here. So, but first, I want to reference a paper or an article that you and your colleague, Dr. Helen Harris, wrote And I loved one of the things that you both kind of were writing here, and I'll just read it here. You wrote, it says that one of the first things we need to do is to exchange the term social distancing for physical distance. And so the concept of social distancing suggests isolation. What we can't afford under stress is to be socially isolated, which you kind of referred to this earlier. The term physical distancing acknowledges the need to minimize exposure to the virus without conflating the ideas of distance with isolation. So this is just fascinating, and I think this is what we need. We need to kind of re-language ourselves through this. So this is fascinating. Can you elaborate a little bit more on this?
Sure. So language is powerful. The words we choose to use are vital. I think that may be why the New Testament uses 3 or 4 different words for love. It's because words mean something. They're not just kind of thrown out there. And what Helen and I were trying to get at is that the term social distancing is very close to isolation. The problem is any of us need to be socially distant. We do need to be physically distant. Now, it was not because of our work that they chose to do so, but others have kind of joined this cavalcade, if you will, in the last week and a half. And the World Health Organization actually last week on Thursday, I believe it was, in their daily press conference made note of the fact they had changed the use of the language that they are using now to physical distancing rather than social distancing. Now, it appears to me that our own CDC and National Institutes of Health both are still using social distancing, which is unfortunate. The reason we think that's so important is because social distancing does imply isolation. It does imply that I'm not going to be connected to you. And what we're only disconnecting from is our physical proximity. Hopefully we're not. And a funeral director illustrated that to me last week. She was talking about how in a recent funeral, even though no one could attend the service, only 10 members of the immediate family, it was live streamed. And when the family came out of the funeral chapel, what they found in the parking lot was 45 friends all sitting in their own automobiles who were watching the funeral on their cell phones, sitting in the car on Facebook Live or whatever it was. So they were present socially, even though they were physically distant. And then they followed in procession as they went first past the deceased's place of work and place of residence, and then ended up at the cemetery. And of course, the requisite only 10 people could be at the graveside. And so most of the people stood at least 6 feet from each other away, kind of encircling the entire scene. But she said, it was the most amazing thing. And it was not the same because people couldn't give hugs and they couldn't even see faces very well with you get that many people spread out that much. But she said it was so meaningful to the family. That's what I mean. We can be physically distant, but not socially isolated.
All right, so now let's get into some practicals here. So what are some practical things that we can do, understanding this stress that we're going through, this kind of loss of life or rhythms or even ceremonies and things like that. So what are some practical things? That was a great suggestion there, but what are like maybe 3 things that we all can be doing to kind of understand, but also kind of make ourselves a little bit more resilient through this?
Yeah, sure. Well, of course, one of them I talked about earlier is to make sure we look at data in context. So don't be alarmed, as hard as it is. Don't be alarmed by the number of new cases. Don't be alarmed by the number of deaths. Look at that in the context of the total. All right, that's very important. In other words, make sure that we are, and I'm not trying to throw the news media under the bus here. Well, maybe I am, but the reality is that the news media is in the business of taking complex topics and creating a human hook out of that to get us watching or reading. I mean, that's their job. And so the old saying, if it bleeds, it leads, is kind of true. At the same time, what we think is, okay, so we see a refrigerator truck parked outside of, uh, um, the hospital in New York, and we think, oh my gosh, there are so many people dying. Well, there are. There are a lot of people dying in New York. What we forget is that in 1995, there was a horrible heat wave in Chicago, and the Cook County Medical Examiner brought in a half a dozen refrigerated trucks parked in their parking lot. And there are photos you can find on the internet. I found them this weekend. This is not the first time. It's 700 deaths in Chicago in about, I don't know, 72 hours or something like that from the heat wave. And they had bodies stacked up everywhere. We think, well, this is the first time this ever happened. No, it isn't. So contextualizing the data and the images is really helpful. A secondary part of that is get your news, get your information from reliable sources, and that's probably not Fox, CNN, NBC, or ABC. I would recommend, if you're just dying to know what's going on with coronavirus, go one time a day to the CDC or to coronavirus.gov or to the NIH and look at their website and get all the data you want. Give yourself 30 minutes to look at it and no more, and then get on with the rest of your life. There are other things to be concerned about. Do not, and if you come upon a Facebook post about coronavirus, just skip right on over it, because it's probably somebody stupid that doesn't know what they're talking about anyway, or at least that's my experience with Facebook. Thirdly, take care of your physical well-being. Get out and walk, exercise. Do it to keep 6 feet distance from other people, but get out of the house. Don't sit there. Don't watch videos like this all day. Watch this one and then go do some exercise or do some eat right. Debbie and I were just looking. I pulled out an old recipe. I grew up in South Louisiana, as if you couldn't tell that from my voice. And I made jambalaya last night for dinner, and I hadn't made jambalaya in 15 years probably. And she made a comment as we were sitting at the table. Her 87-year-old mother is living with us right now for this period. And Debbie said something about my making jambalaya, and I said, yeah, when you're not eating out very much, you got to pull out all the old recipes, and that can be very beneficial to our mental health. Explore a new skill with cooking, and it's quite a challenge to figure out, now what can I do with the 7 things I was able to buy at the grocery store on this trip. So I think we can really use that to enhance our own resilience and our own well-being.
That's awesome. I love that. I'm just sitting here laughing. It's so true. Okay, so hey, all you viewers, we're going to get into some Q&A here. So go ahead and use the Q&A button there at the bottom of your screen, or the browser you're using, to type in any question you'd like to ask Dr. Hoy, and then I'll get those to him. But while you're submitting your questions, one last question here, and then we'll get into the Q&A. Can you give us some scriptural insights to the heart of God that can tie all this together? Anything that would be really encouraging from the Word, or just to encourage our own place of our faith in Christ?
One of the things, Joe, I'm glad you told me in advance you were going to ask, because I've been thinking a lot about that. So I should probably say one of my self-care strategies is I've been listening to Christian worship music. I love, one of my favorite new groups, I just discovered them this weekend. It's called, I think they're called Shane by Shane, or Shane plus Shane, or Shane and Shane, or something or another. Anyway, they're a Texas kind of contemporary Christian group, but they're singing lots of things that are simply scripture set to music, and it's not particularly loud, and it's rather contemplative. And I was listening to one last night from Psalm 91, which is the psalm that says that no matter what, no matter the pestilence that flies by day or the arrow that flies by night, that we are protected under the hands of God. And so those kinds of images are very, very helpful for me to remind me, we were surprised by coronavirus. It's novel to us, did not come as any shock to the creator of the world. He knew a long time ago that coronavirus was going to be something that we faced in the world in 2020. It was not that he woke up one morning in February and said, "Oh, look at that. I didn't realize that was going to be happening." So that's very calming to me to know that the Lord I serve has always been in charge, and nothing's changed that at all. Yesterday in the Bible study group at First Baptist Woodway that Debbie and I lead, which is now meeting, of course, by Zoom, like every other small group in a church in America or Canada or most anywhere else in the world, I suppose, we looked at the passage from 2 Chronicles chapter 20, where the great King Jehoshaphat was had learned that there were three enemy armies coming against the people of God all at once. They'd conspired against them. And Jehoshaphat, in this amazing prayer, first he leads the people to pray and fast, and I think that's an awfully good idea for us. If you could see me, you would realize I'm not one who's given to fasting very often, but I think that's an extraordinary principle. Be that as it may, Jehoshaphat leads the people to pray and fast. And then at the end of his prayer, he says this incredible thing that I probably won't quite get right, but he said, "Lord, we are standing here and we do not know what to do, but our eyes are on you." And I think that is a powerful promise to people of God today, that we don't know what to do about this. Our public health officials don't really know what to do. All of our strategies really are whistling past the cemetery, to use that old phrase. We are hoping that these things are going to work, but nobody really knows whether they will or they won't. We do not know what to do. We have no vaccine and we have no effective treatment. So that leaves us with, we better be leaning on the one who does know what to do, which leads me to this wonderful verse in 2 Timothy 1 where Paul writes to his young protege, and he says, just be reminded that God has not given us a spirit of fear, but of love and of power and of a sound mind. And I think it takes all of those things. So those are kind of the things that are helping me, listening to music, making sure that I'm talking with my Christian community a lot about what's going on and how we're doing, how we're coping. But I'm not frightened, and I've been really trying to take stock of that. Am I just pretending that I'm not? I learned a long time ago, death is not the worst thing that happens to us. And I'm not frightened by this virus, but I am concerned about both physical health, but more importantly, I think I'm concerned about the social dimensions of how we're coping and the I'm going to call it environmental anxiety that's present in our society right now.
Wow. Dr. Hoy, this has been so encouraging and very beautiful. I love your perspective, and just the father heart of God, the security and the safety and the beauty of God, even in a time like this. And it's not a surprise to him as it is to us, obviously. But now I want to move into some Q&A with you and some questions that are coming in. All right, so you kind of mentioned this already, but is the social anxiety. So do you see this more as a hysteria or global paranoia rather than a physical threat?
Yeah, absolutely not. I'm not about to say this is not a real thing. I am not for 1 second. Please never quote me as saying I'm not taking this seriously. I am trying to take it seriously in context, however, rather than where the anxiety comes about for us, I think. And I'm avoiding the words paranoia and hysteria in my own vocabulary. I don't find them to be useful words. What I am saying is that we are looking at this without context. And part of that is because most of us don't remember, and few of us have enough global perspective, to be honest. We've never lived outside of the safety and confines of the Western world. where we are fairly secure from such things. But I remind our viewers, 1 million people die every year from malaria in the world, and 1.3 million die from tuberculosis every year. The number of people that coronavirus will kill probably will not move it into the top 4 or 5 in the United States, even of causes of death. 750,000 about the United States die from heart cardiovascular disease every year, and another, I don't know, 350,000 or so, 400,000 from cancers of various kinds. And we don't think we're getting anywhere close to those numbers with these deaths. So I think what I'm suggesting is where the anxiety is coming from is looking at the current number of deaths or number of cases, paying no attention to the number of recoveries. That's almost never being reported, paying no attention to that whatsoever, and instead camping out on these data points that are frightening without putting them in context. I think that's what's provoking the anxiety.
Right. Yeah, I totally agree. Okay, so here's
another question. Then on top of that, you go to the grocery store and there's no toilet paper or whatever else you're looking for, and then that makes you even more anxious, and that becomes self-fulfilling because I see there isn't any. So that means a friend of mine told me he's a clinical psychologist at Baylor Scott and White, and he told me, I went to the grocery store, there had been no eggs, so I bought 2 cartons. He said, I've never bought 2 dozen eggs in my life, except I thought there might not be any here next time, so I better buy 2 now. That's the kind of behavior that I'm talking about that raises our anxiety.
Right. So that's kind of the fear of scarcity, all that kind of stuff. All right. So this is
and I think chickens are laying about as many eggs as they ever did. I don't think they're bothered by coronavirus. Actually.
Yes. No, I think, my team and I, that we were talking about the grocery store and, all the pasta and all the junk food's all gone, but there's tons of fresh food there. That's eating anyways. Okay, so a question here is, what would be your thoughts or your encouragement for how to help somebody who's dealing with some sort of mental health disorder or anxiety, depression during this time? What would you encourage?
Yeah, well, I'm assuming some of your viewers are mental health therapists and others are not. What we know is that depression and anxiety both probably are handled best from a psychotherapeutic standpoint with cognitive behavioral therapy interventions. But anybody can practice cognitive behavioral therapy, even if you're not a cognitive behavioral therapist. You may not have been trained like you or me to actually see people clinically, but you can still practice many of our techniques anyway. I am what is frequently called a solution-focused cognitive behavioral therapist, which I think that makes me a CFCBT or something like that, but that's a lot of initials. What that really means is I like to ask questions about, so what would be different if, how can we change our thinking, in other words, because so much of the anxiety is thought-provoked anxiety. It's, I assume that things are going to always be like they are right now, so I prepare for the worst, and in preparing for the worst, that becomes a self-fulfilling prophecy. So what I would do if I were helping somebody is I would ask them, certainly mindfulness or what I call godfulness would be very helpful to kind of stop, take a breath, think, work on your breathing, relaxation. Think about what is the worst case scenario and how likely is it that would happen? Well, I might lose my job. Well, that's true. I might. Am I making preparations? Am I doing the things that I could do? So, in other words, I'm not being overly cautious about what we spend, but we're paying attention to it. Not because I think I'll lose my job necessarily, but because I'm not sure I'm making great decisions right now, and I'm not going to go out and buy a car because I'm not making great decisions right now. Probably, I'm too tired. I've been on doing webcasts and things like that. So I'm probably not the best. So that's what I mean is kind of working through questions, pondering we ask people sort of the flippant, so how are you? But that doesn't really get at anything. Instead, say, what's been the biggest challenge for you today? What's the hardest piece of this you're facing right now? What's been the scariest thing you've seen on the news in the last 24 hours? And that's where I believe we sort of move into people's lives in ways that are helpful for them.
That's great. I love it. Okay, now here's some questions that deal with kind of the challenge of having an older loved one who is maybe sick with the virus, maybe they passed away with the virus, or they have a friend that has the virus. There's several questions, so I'm going to try to sum up these all in one, and you can maybe kind of address it in a multifaceted way. But the question is, we didn't get to go to their funeral, or we didn't even have a funeral. So how do we grieve through that? We couldn't even be there, or they're in the hospital, but I can't go, like you mentioned earlier, they can't go and see them. It's through the window. Or, what are alternative rituals for a funeral? What are ways to comfort somebody who has a loved one that's in the hospital with that? What are the things? How do we address these things? Because there is that social disconnect with these people who are in suffering, and they're suffering because it's exacerbated in a way because they can't have that comfort from others. So kind of speak to that.
Sure. Well, I think, of course, being involved in whatever way is both healthy and allowable is helpful. So if we can't gather in a big group, maybe we can sit in the car all in the same parking lot and watch on our phones and wave to our neighbors in the car. I mean, I think that's a possibility for funerals. That I don't know that we're talking a lot about those kinds of possibilities. I also think that doing something that I would like to do anyway. So I think about what would I do if I could attend the funeral. Well, one thing I would do is I would go up to my friend and say, here's a way that your dad's life really benefited me. Here's something I took from your dad's life. Here's a character quality that I learned from him. Or I learned this skill from him, or your dad's life touched me in this particular way. If I can't say that, I can write it. I don't even have to go buy a sympathy card, though Hallmark would appreciate it if you did. It will help their sales in the recession. But otherwise, just write a note, a blank note to somebody and say, I'm thinking about you. We've got lots more time now, maybe, because we're not commuting or whatever it is. Get yourself some note cards, which you can buy from Amazon. You don't even have to leave the house. And you can write a note every day and make one of those notes somebody whose loved one has died from coronavirus, or actually much more likely that they would not have died from coronavirus. They just died from something else that they would have died anyway. So remember, 98 or 92% of the people who die in America this year will not be people who die from coronavirus. 92% will be people who die from other things. So I think we want to make sure that we are not forgetting those folks too.
Oh, that's great. Okay, here's another great question here. This is kind of interesting, and this is kind of your counsel as a professional and as a spiritual pastoral father. Okay, so how can we encourage a person who's deeply feeling that even though she feels called by God, that calling's been taken away? This is a person who's outreach personality, very out there, but is having trouble changing her perspective to this, and so it feels like this calling is being taken away and they're being punished by God. What would you say to that?
Yeah, I think I would want to take stock of exactly what that calling is. Calling is bigger than a job. It's bigger than a particular task. With my students, we talk a lot because I teach in Medical Humanities. And if you know anything about Baylor University, you know that about half of our freshmen who come to Baylor are declared pre-med when they arrive. So about 1,500 of them this fall will say they are pre-med when they get here. In 4 years, we'll graduate 275 of them to medical school. That means over that 4 years, about 1,125 of them have mysteriously changed their calling. Sometimes it's organic chemistry, by the way, that changed their calling for them. But be that as it may, what I talk about with calling is that it is the place where my gifts, my aptitudes, my passions, and my skills come together with what the world needs. So, in other words, if you take gifts, aptitudes, passions, and skills, that creates an acrostic of gaps. My calling fills a gap in the world. So, what God has called me to do is something He's uniquely gifted me to do. He's given me an aptitude to learn, He's given me a passion for it, and He's probably given me some skills, or I'm able to develop some skills to do that. And so I think it's important to think my calling has to be bigger than a particular job or task. My calling, if I'm a hospice chaplain right now, I can't see patients for the most part because, okay, does that mean I'm not living out my calling? Well, I don't think my friend Larry Holden, who's the chaplain of Baylor Scott and White Hospice here in Waco, would say that. I think he's very much living out his calling. He's doing so in different ways because his calling is bigger than a job or a task. So my reminder to us is a great time to think about, well, what does calling mean to me? Or read Og Guinness's book, The Call, or I don't know, something like that, and think about my calling is to be a disciple who loves people and who sees to it that the great commandment and the great commission are fulfilled in my world, in my lifetime, that I love God and that I love my neighbor as myself, and that I teach the gospel in such a way that the gospel is promulgated throughout the planet. And my goodness, we can do that with a note card and Facebook and Zoom and a lot of other ways. So make your calling bigger. That's what I would suggest.
That's awesome. I love it. I love it. Oh, I love this. Okay. Just a couple more questions, just so we, just for the sake of time. This is a good question for somebody who's already been grieving. Life had grief in my world already. The cycle seems to be revisited and triggered into new losses. Any suggestions for how to put the pen in the ripples?
Yeah, absolutely. So again, be very, I commend that viewer for asking that question and for being self-reflective enough to see it. A lot of times we realize I don't feel right, but I can't pin it to a particular thing. I don't know what caused it. And this person clearly understands that this is a revisiting. The word he or she used, I believe, was triggered or re-triggered. In other words, we continue to re-grieve our losses. And this very well it could do that because it reminds us of something else, reminds us of, which all losses in some ways do. It reminds us of one we had some time back. So I think the first thing to do, of course, is to acknowledge, I believe this is reminding me of that loss. What was it about that loss that made it so difficult? Here's the most important thing. What did I do then that helped me get through that loss at that time in a way that helped me become fully functional again? So grief is not, there really is no such thing, for example, as recovery from grief. I don't think we get over our losses. We enfold our losses into the rest of our lives so that we are transformed into different people. We become different by our losses, and therefore we don't get over them as much as we learn how to live in the light of them. And so really what we might be doing now is just saying, here's another piece of this loss I didn't know that I needed to deal with. And so I'm going to go back and deal with that. I'm going to actually work through that piece. The last thing I was going to say on that, Joe, is we have a term in the bereavement biz called disenfranchised grief. It was actually, the term was coined by my colleague Ken Doka, who has done extraordinary work in the field of bereavement. And Ken talked about disenfranchised grief as that which is kind of socially unacceptable. So we think of miscarriages frequently as a disenfranchised loss. A death after drug overdose is sometimes disenfranchised. People whisper about it. There often is a lot of shame involved with it and all of that. Suicide sometimes is that way. And what I fear might happen in this particular context is that we are disenfranchising the non-COVID losses. So the 92% of people who don't die from COVID, their names are not in the newspaper. They don't make the front page. They are, in fact, you can, if you're given to reading the newspaper obituaries as I am, you can hear the heartache of families who say, because of social distancing guidelines, we'll have a funeral at some point in the future. And it's very sad to me because these people are not dying by COVID. We've only had one death by COVID in our county, but I think there were 14 obituaries in the newspaper yesterday. So, and none of them, by the way, was the one person who died from COVID. So what I'm saying is that I think we want to be very careful not to disenfranchise the non-COVID losses, which are certainly going to be the vast majority of deaths we're going to see in this next year.
Wow. Yeah, no, it's good. Okay. And then one last question, and I want to just thank everybody for all the questions. We don't have time for all of them, but I have one last question here, and this is good as we focus on our young people. And this question is, as a counselor who is solely conducting telehealth, mental health, teletherapy, what should I know about grief when it comes to serving teenage clients?
Yeah. So teenagers are just like the rest of us. They experience loss in terms of things that are dear to them, whether that's a person, a relationship, a role, a hoped for experience that now that dream is dashed. They are different from us in that one of the advantages one has to living a long time is that you've had a lot of time to practice this. And when you're only 15, you haven't had much time to practice. And so when, part of my equanimity, if you will, with the current crisis is I was in a terrible car crash a few years ago from which I'm the only survivor, and was within a hair's breadth of having been killed myself. I've dealt with deaths of parents, death of a child, death of lots and lots of losses over my life that you just do when you've lived 60 years. You tend to have a lot of those kinds of experiences. When you're 15, you don't have all that life experience. It's probably one of the reasons that older people tend to deal with loss, as a general rule, tend to deal with loss more easily than young people do, is they just have more experience with it. So one thing with teenagers is we have to talk with them about their imaginations. What do they think is the worst thing that's going to happen as a result of this? And ask them, what do they think about what did happen? Ask questions, invite them to share those experiences, and to know that what might seemingly be a little loss, especially for other members of the family, can be easily disenfranchised for a teen. So, I can imagine, Joe, that your daughter has already been told by some well-meaning adults in her life, not you, I'm certain, but by some well-meaning adults, how dare you be all upset about not having a prom or a high school graduation? Don't you know there are people dying around here? And that kind of stuff happens all the time with teenagers. Their love relationships are disrespected by parents or sometimes even their peers. Oh, it was just puppy love. And I think one of the most important things we do as mental health professionals with teenagers is we acknowledge that this loss is real. And one of the things I have found is that the loss I'm walking through right now is probably the big one for me. It's probably the one that's the biggest. Now, there may be another big one next year. There may be a bigger one a month from now. But for right now, today, if I'm telling you about it, it's the big deal in my life. And therefore, as a professional, I have to honor that place with my patient, with my client, and to hear his or her heart about what they're struggling with.
Wow. All right, Dr. Hoy, I am so thankful. This has been so rich and meaningful. I think your perspective has helped all of our viewers and everybody who's watching and everybody who's going to keep watching this, obviously, through the recorded. I think you're helping us to pivot our perspective, and to really see a more beautiful picture of how we can get through this, but also understanding the reality of what's happening and what will happen, but be prepared, and just from the spiritual to the natural as well. So I want to thank you for being with us and giving us your wisdom and your insight on all this, and hopefully we'll have you on in the future again. This has been fantastic.